All right, today we're tackling a bit of medical terminology that trips a lot of people up. It's about a lung condition, and you've definitely heard of its more famous cousin. But trust me, knowing the difference is super important. So let's just get right into it. So, pneumonia. We've all heard that word, right? It's one of those medical terms that's just part of our vocabulary. But what about pneumonitis? It sounds similar, and that's exactly where the confusion starts. We're going to clear that up right now.
Okay, so first things first, let's just put these two side by side. The key difference is actually, well, it's a lot simpler than you'd probably guess.
Okay, here it is. This is the whole ball game right here. Think of pneumonitis as the big umbrella term. It just means inflammation in the lung. That's it. Now, pneumonia is just one specific type of pneumonitis. It's the kind where the inflammation is caused by an infection. So yeah, all pneumonia is technically pneumonitis. But not all pneumonitis is pneumonia. Simple as that.
Okay, so that key word we just used is inflammation. It's central to all of this. But what does that really mean when it's happening inside your lungs? Let's dig into that a little bit.
All right, so if you look it up, the textbook definition is inflammation of the lung parenchyma. And parenchyma is one of those fancy medical words, but don't let it throw you. All it means is the actual functional tissue of an organ. You know, the part that does the real work. So for the lungs, we're talking about the tissues that handle the gas exchange, the stuff that lets you breathe. You know, here's maybe an easier way to think about it. Imagine you could sprain your lung. That's kind of what pneumonitis is like. The tissue is irritated, it's swollen, but it's not necessarily because a bug, like a virus or bacteria, is in there causing trouble.
So that's the big question then, right? If it's not always an infection, what else could possibly be causing all this inflammation? Well, it basically boils down to three main culprits.
And here they are, the big three. First, you've got your infectious agents. We already talked about that one. Then you've got irritants and other things you might be exposed to out in the world. And the third one? That's your own immune system getting involved. Let's take a closer look at each of these.
So, cause number one, infectious agents. Pretty straightforward. We're talking viruses, bacteria, fungi. And like we said before, when one of these is the clear bad guy causing the inflammation, that's when a doctor is most likely to just call it by its more specific name, pneumonia.
All right, on to category 2, irritants and exposures. This is literally about stuff from the outside getting in and causing problems. We're talking about things you might breathe in, like smoke or nasty chemical fumes, chlorine gas, for example. It can also be from things like radiation therapy. And get this, even aspirating stomach contents can do it. All of these things can directly tick off your lung tissue and kickstart that whole inflammatory process. And that brings us to our third and final cause, immune reactions. Now, this is where it gets really interesting, because here, the body is basically attacking itself. Your own defense system gets kind of confused, or maybe just goes into complete overdrive, and starts causing inflammation when there's no real outside threat to fight. Some of the best-known examples of this have these really memorable names, which I love. You've got farmer's lung, which happens from breathing in dust from moldy hay. And then there's bird fancier's lung. Yeah, that's a real thing. It's from being exposed to dust from bird feathers or droppings. In both of these, it's not an infection. It's the person's own immune system just totally overreacting to what they're breathing in.
And this kind of immune-driven inflammation doesn't always come from something you breathe in. It can also show up as a complication of other autoimmune diseases that you might have heard of. Things like rheumatoid arthritis or lupus or Sjogren's syndrome. In those cases, the immune system is already prone to mistakenly attacking the body, and sometimes the lungs just end up being one of the targets.
Okay, so we've covered a fair bit here, right? We've defined pneumonitis, we've separated it from pneumonia, and we've walked through the three big causes. So, after all that, what's the one thing you absolutely need to remember? Here it is, boiled down to one single sentence. Ready? Pneumonitis is nonspecific lung inflammation caused by infection, irritants, or immune-mediated reactions. That's it. It covers everything. The what, nonspecific lung inflammation, and the why are three culprits: infection, irritants, or the immune system. That's your golden takeaway right there. So from now on, whenever you hear someone talk about lung inflammation, you're going to be way ahead of the game. Because now you know the most important question to ask isn't if the lungs are inflamed, it's why. Is it an infection, an irritant, or is it an immune reaction? Asking that one question, well, that changes everything.